Laxmi Kondapalli. I am a reproductive endocrinologist and infertility specialist with a special training and interest in oncofertility, and I work at the Colorado Center for Reproductive Medicine.
Excellent. So I have a few questions for you. So I myself am a breast cancer survivor. I was diagnosed at 28. I'm now 30. And while you were talking about fertility and preservation, I had a few questions that I thought might be interesting to other young women out there. So the first would be, so I'm currently on tamoxifen, and I'm wondering what kind of fertility testing I can get while I'm still on tamoxifen to know if I even have any fertility to make it worth it to go off of my tamoxifen. And I've heard a lot of varying opinions on what you can test and what's accurate.
Right. So I think the challenge about tamoxifen is just the way that that medication works. It works on the level of the brain to prevent the production of estrogen throughout the body. And what's interesting about a lot of the fertility tests and how the eggs and the ovaries develop and how eggs grow are from signals from the brain. And so when you're taking a medication that suppresses those brain signals, it's very hard to do fertility testing and interpret what the results mean. Okay. So in my practice, in patients who are on tamoxifen, I actually recommend not doing any testing because I don't want to be overly concerned, and I don't want my patients to be overly concerned that their fertility is compromised, but it just may be a factor, a result of the fact that they're on a suppressive medication. So for my patients who are on tamoxifen, I recommend being off the tamoxifen for at least 3 months to release that suppression on the ovaries, so then I can get accurate fertility numbers.
Okay. And so would you still recommend doing fertility testing before starting, or would you recommend your patients just starting naturally and only doing fertility testing if a problem comes up?
Yeah, so I think there's 2 different ways of approaching that. For many of my patients, I tell them, you can try getting pregnant on your own, because for a lot of folks, it will happen naturally on their own. And waiting for about 6 months, and really depends on the age of the woman. For women who are under the age of 35, waiting even up to a year is appropriate, and seeing if that natural conception happens. For women over the age of 35, we recommend seeking a fertility evaluation and that fertility testing if they haven't been successful in getting pregnant in 6 months.
Okay.
For a lot of my cancer survivors, they may have a narrow window when they could be off of their tamoxifen, and so waiting a whole year just to see if you can get pregnant just may not be possible. And they're, oncologists would like them to go back on the tamoxifen after their pregnancy. So in that setting, I recommend waiting about 6 months, trying on your own, and then seeking a fertility evaluation.
Have you had experience with patients who've gone off of tamoxifen and successfully gotten pregnant?
I have, and in fact, I take care of a lot of young breast cancer patients who may come to see me for fertility preservation. We have frozen their eggs and embryos. That does not preclude their ability to try having children on their own, and they can go on and try, come off the tamoxifen. The other key thing about being with tamoxifen is I recommend being off tamoxifen for at least 12 weeks before trying to get pregnant, because the half-life of tamoxifen is so high, it takes a long time for your body to metabolize that medication and completely eliminate it from your body. And we know that tamoxifen is pregnancy category X, where there is good data that tamoxifen is associated with fetal anomalies, and that's why we don't recommend women getting pregnant while on it.
Right.
And so coming off the tamoxifen for at least 12 weeks and then trying on their own. And I have breast cancer patients who don't ever need me. I have their frozen eggs and embryos, but they have spontaneous pregnancy. But they still feel really, grateful that they were able to at least undergo fertility preservation, because maybe for their second and third pregnancy, we may be able to use their frozen eggs or embryos.
And what about doing IVF after having breast cancer treatment? Like, what about the risks with that? If say I find out that I can't conceive naturally, is that an option, and what would that look like?
It is. So certainly pursuing fertility treatments, whether it's in vitro fertilization, whether it's using less aggressive treatment like oral medications or fertility medicines that come in the form of injections, that may be an option for women after they've gone through treatment. Let's say I have a woman who didn't have the opportunity to freeze her eggs or embryos, and is now 3-year survivor or trying to get pregnant, and then may see somebody like myself who's a fertility specialist, and we may think about a variety of different treatment options to help them get pregnant. And certainly I've had women who have gone down the path of doing in vitro fertilization and have been successful doing that. For women who have hormone-sensitive cancers like breast cancer, especially if your tumor was estrogen and progesterone receptor positive, there are additional medications or special types of protocols. And protocols are just a recipe. What are all the different ingredients that we need to use to stimulate the ovaries to produce mature eggs? And so typically what I do in my practice for women who have breast cancer is to use a medication that really maintains very low estrogen levels. So we give them fertility drugs, which gets their eggs to develop and grow and mature, but you can give another medication that will really temper.
Is that it?
Yeah, you can temper their ovarian response.
Right.
Yes, and that medication is an aromatase inhibitor like letrozole.
Okay, so as far as the data shows, it's safe for women to do IVF if they have estrogen.
So we do have data looking at breast cancer patients, so premenopausal breast cancer patients who there's two groups of women. Premenopausal breast cancer patients who pursued egg and embryo freezing, so some sort of fertility preservation option, compared age-matched comparison to premenopausal breast cancer patients who did not go through fertility treatment. The question is, does doing fertility treatment increase my risk of recurrence? Is my breast cancer at a higher chance of coming back because I pursued some sort of fertility treatment, which presumably increases my hormone levels? That's the best data that we have. The survival rates and the disease-free survival in both of those groups was the same.
Okay.
So it does not seem that pursuing some sort of fertility treatment in the form of egg freezing, embryo freezing, IVF increases that risk.
Okay, great. And I guess just as one last kind of final message, what would your message be to young women who are currently experiencing breast cancer and fearing that they'll never have a family and feeling really kind of down and hopeless about it? What do you say to those women?
I meet a lot of young women who are in incredibly stressful times in their life because they've just been diagnosed with their breast cancer, and now they have to think about making very critical decisions in such a short period of time. What we can say is that, one thing that I tell all of my patients is that there's lots of different ways of making a family. Sometimes it's using your eggs and embryos, sometimes it's using somebody else's eggs and embryos, and it's sometimes having somebody else carry the pregnancy for you. But the most important thing is that if you have a vision for a family, you can seek out care or advice from people like myself who are reproductive endocrinologists, and if you're fortunate enough to find somebody who's really an oncofertility specialist, that's somebody like myself who's a reproductive endocrinologist but specializes in the care of cancer patients, who has that additional specialized training and interest, and really has a lot of experience in taking care of women with breast cancer and thinking about how we can preserve their fertility and, most importantly, have a safe pregnancy.
Thank you so much. That was so helpful. I'm gonna hug you.
Please do. I'm a hugger.
Yeah, me too. That's awesome.